Sleep is a vital aspect of our daily lives, a fundamental moment of rest and recovery for the body, in which different phases alternate cyclically, each with its own specific characteristics and functions. Working at night, staying up late studying, or watching television series, suffering from insomnia, or having a newborn who wakes up and cries at all hours are all situations that have a negative impact on the quantity and quality of sleep, preventing rest properly. It is no coincidence that according to data from studies conducted by the World Health Organization and international medical institutions, approximately a third of the world's population does not sleep a sufficient number of hours. The question we all often ask ourselves is, how many hours should you sleep per night? To do this, we will divide the hours of sleep into 3 groups: less than 7 hours, between 7 and 9 hours, and more than 9 hours, and for each we will see the effects on health. Less than 7 hours. For adults, regularly sleeping less than 7 hours a night has been linked to several physical and mental health problems, but most importantly to an increased risk of premature death. Even if you may not initially experience obvious symptoms, over the years the consequences of chronic lack of sleep tend to worsen, favoring the onset of certain pathologies, more or less serious. According to a study conducted at the Tehran Heart Center in Iran, among a sample of more than 1 million people from 6 countries, those who slept less than 7 hours a night were 7% more likely to develop hypertension. The probability rose to 11% in subjects who reported sleeping less than 5 hours a night. Not getting enough sleep also increases the risk of developing cardiovascular and cerebrovascular diseases. In people who sleep less than 7 hours, there is a 4 times higher risk of stroke compared to those who sleep between 7 and 8 hours. This is the conclusion of a study conducted by researchers at the University of Alabama at Birmingham. Emerging evidence has identified that sleep deprivation is also a significant risk factor for metabolic syndrome, diabetes, and obesity. This is because a series of hormones that regulate hunger and appetite, such as leptin and ghrelin, are negatively affected. The first is produced by adipose tissue cells and regulates the feeling of satiety, while the second is mainly produced by the stomach when it is empty and stimulates appetite, triggering the desire to eat. Lack of sleep can increase ghrelin levels and decrease leptin levels. This results in increased hunger and a reduction in the sense of satiety, which therefore leads to consuming greater quantities of food, and in particular high-calorie foods. Sleeping less than 7 hours, or even worse than 6 hours, also increases the risk of developing neurodegenerative diseases, such as Alzheimer's disease and Parkinson's disease. A study published in 2021 in Nature concluded that people aged 50 to 60 who slept 6 hours or less a night were 30% more likely to develop dementia later in life, compared to those who slept 7 hours a night. Between 7 and 9 hours. Although daily sleep needs vary slightly from person to person, National Sleep Foundation guidelines recommend that adults and the elderly should sleep between 7 and 9 hours a night. This is a healthy interval within which the body is able to recover its physical and mental energy to better face the following day. Not only that, sleeping a sufficient amount of hours helps to strengthen the immune system, regulate the production of hormones, as well as activate those cellular repair and regeneration processes. Sleeping regularly between 7 and 9 hours allows the brain to do a sort of cleaning, as it takes care of reordering and eliminating useless information, as well as the metabolites produced by brain activity during wakefulness, but also of consolidating memory and fixed memories. It is important to underline, however, that it is not only the quantity of hours we sleep that counts, but also the quality of sleep. In fact, according to research by the American College of Cardiology, the life expectancy of those who sleep well is higher than that of those who are used to sleeping little and badly. For men, life expectancy was 4.7 years more, while for women, it was 2.4 years more. The study found a clear dose-response relationship, according to which the higher the quality of sleep, the greater the reduction in mortality. Sleeping an adequate number of hours is not enough, said the study co-author. It is necessary to have a restful sleep and not have problems falling asleep and staying asleep. More than 9 hours. If sleeping too little is bad for your health, sleeping too much can also be harmful. Regularly sleeping 9 hours a night or even more could be a symptom of a sleep disorder or a health problem, but also the side effect of some medications. A study published in the Journal of the American College of Cardiology found that a sleep duration of more than 9 hours is associated with a higher risk of cardiovascular disease, with a 34% greater chance of experiencing a myocardial infarction in one's lifetime. This is because sleeping too much could negatively affect the body's metabolic and inflammatory processes, increasing the production of pro-inflammatory cytokines and C-reactive protein. Habitually sleeping more than 9 hours has therefore been linked to several negative health effects, such as cognitive impairment, increased inflammation, and a higher risk of diabetes, heart disease, and stroke. Spending too much time in bed could therefore directly influence some risk factors or be a symptom of other medical conditions such as narcolepsy, obstructive sleep apnea, and depression. According to a study conducted by researchers at Boston University, prolonged sleep duration may be an indicator of early neurodegeneration and therefore a useful clinical tool for identifying those who have a higher risk of progressing to dementia within 10 years. The mechanisms underlying prolonged sleep in early dementia appear to be due to neurodegenerative changes in brain regions involved in the regulation of sleep and wakefulness, thus leading to circadian dysfunction and impaired melatonin production and secretion. The results appearing in the journal Neurology showed that people who consistently slept more than 9 hours a night had double the risk of developing dementia over 10 years compared to participants who slept 9 hours or less. In conclusion, we have seen how sleep is extremely important to the health and well-being of every individual. In a world in constant movement, based on hectic and often harmful lifestyles, such as poor nutrition, sedentary lifestyle, and abuse of electronic devices, especially before going to bed, sleep is one of the first elements that is neglected. Sleeping regularly between 7 and 9 hours every night is a fundamental rule to respect for good sleep hygiene, as is trying to always go to bed and get up at the same time. It's true that by doing this you will spend about a third of your life sleeping, but keep in mind that the time you spend in bed is not wasted time. Sleep is a primary and physiological need that allows our survival and therefore our life.